Can hyperopia cause amblyopia in children? Imagine your child's eyes trying to focus on a book or a toy, but the images keep coming in blurry. This is often caused by hyperopia or farsightedness, which can sometimes lead to a condition called amblyopia or lazy eye. When hyperopia is moderate to high, especially at or above plus 4.5 diopters, the risk of developing amblyopia increases significantly. Studies show that about 8.6% of children with hyperopia at this level develop amblyopia in both eyes, which is known as bilateral or isometropic amblyopia. Even children with hyperopia above plus 3.25 diopters are more likely to develop amblyopia compared to children with normal vision. In fact, in preschoolers, hyperopia greater than plus 3.25 diopters is linked to amblyopia rates as high as 34.5%, versus just under 3% in children without hyperopia. The reason hyperopia can cause amblyopia is that the eyes struggle to focus clearly on near objects, creating blurred images on the retina. When the brain receives these blurry signals, it may start to ignore or suppress the image from the hyperopic to avoid confusion. Over time, this suppression can lead to the brain favoring the clearer, and the weaker becomes less used, resulting in amblyopia. Hyperopia can also be linked with strabismus, which is when the eyes are misaligned. Children with high hyperopia are more prone to both amblyopia and strabismus, and having both conditions can make visual problems worse. Early detection is key. If a child has significant hyperopia, even without signs of a misalignment, prescribing glasses can help correct the focusing problem and reduce the risk of amblyopia. Treatment usually involves giving the child glasses that match their prescription and sometimes patching the stronger to encourage use of the weaker one. These treatments work best when started before the age of 7, during the critical period of visual development. If amblyopia is left untreated, it can cause permanent vision loss and increase the chances of vision problems later in life. That's why regular exams for children are so important, especially if they have hyperopia. In summary, moderate to high hyperopia in children can interfere with normal visual development and lead to amblyopia by causing blurred images and sometimes associated a misalignment. Early optical correction and proper management are essential to prevent long-term vision issues and help children see clearly as they grow. Always consult an eye care professional for personalized advice and regular screenings to keep your child's vision healthy.